Aging underneath an umbrella organization that will become a larger county department. Some kind of, and I've already kind of vetted this in other places, other committees, that it's not a unique, there's been other counties that have done similar things. Part of moving the Office of Aging underneath a larger umbrella organization will affect that director position. Right now in Chenango County, the Director of Aging Services operates as a department, as its own government structure. If we proceed forward with placing it under a new Department of Human Services, which that will house social services, aging, custody, the way that structure is designed to work is that Director of Services or Director of Aging doesn't operate as a department head anymore. It operates solely to direct the Office of Aging. And in regulation, it is important to point out that it's the regulations specify that the Office of Aging has to have a full-time director that only oversees aging functions. It can't be commingled with other funding sources. It can't be commingled with other assignments. So in other words, in our ecosystem, the Director of Aging can't also direct adult protective services. That's a social services function. So in order to make that move work in a new ecosystem, I keep using, but to make it work correctly, we have to eliminate the position as it exists now as a department head and reclassify it as a new title that isn't designated as a department head and operates underneath a different organizational structure. So to do that correctly, we have to create a position that is termed the Director of Aging Services, I believe. Mr. Caldwell has to do the job specs and the position description, and of course then set the salary for that position. So, that's all in the context of the move that's being discussed and processed through the board right now.
So in essence, we're not adding another person, right?
No, it's the position as it exists now will be eliminated entirely in favor of this one replacing this in the organizational structure.
And so they'll have to answer, that person will have to answer to somebody.
Yes, Mr. Creel will be happy to hear that they answer to the Deputy Commissioner in Social Services and then to the Commissioner Report. Yes, they would answer up to the Deputy to me for reporting, for regulatory compliance, and of course for discussions with the board and committees. I would be the one that would report to the committee for the department.
And so you've probably been in touch with the state on potential of moving this agency into human services.
Yes, that's part of what was discussed yesterday, that there's a specific path to that involves a submission to a change in the 4-year plan that the aging department.
And that's already established, that 4-year plan.
Yes.
And so you can modify it as you need.
Right, this would be a modification.
To it, yep.
The two stipulations of those program modifications is anything that affects staffing patterns or staffing titles, or anything that affects services. Both those have to be described and submitted to the state for their eyes and their approval. Obviously, we've been discussing the fact that services are not being eliminated, that we're keeping service level whole.
Service levels remain the same.
Right.
Correct.
But because the title changes and its reporting structure changes in terms of where it lives in the county ecosystem, that's the second time I've used that term today, we would submit that to the state so they'd be aware of it, because it is a change in the plan as it exists today.
So that has not been submitted yet?
No. If the board creates that position, we would submit that as part of the plan amendment. And that also falls in line with the public hearing and the meeting with the advisory groups to discuss how that new system works.
I think the major concern is folks are just hearing elimination of positions and increased services, and I know that's the farthest from the truth.
No, I'm glad that my friends from Aging are here today, because we've been going over this chart numerous times to try to discuss the fact that it's been a little bit misrepresented in terms of elimination, when it really is more of a
reorganization.
Yes, and a shifting of titles and a shifting of. There are a few senior outreach positions that were established in the last couple of years that are looking at being shifted and right-sized to the boots on the ground that you mentioned before. Some of the ancillary functions that happen in an umbrella organization make things like an administrative assistant or an isolated financial director in aging not necessary because it's in the context of an overall schema. So as it is now, for example, the accounting supervisor that we have oversees the Department of Social Services and also the Department or the public development pressing area. If this move happens in the way that we've structured it, they will also then oversee aging with the assistance of another position that helps that happen. To keep
That's
all
your
that-
accounting,
Yes, the
the
accounting
level.
supervisor, and then there's that head examiner level that kind of helps
and they'll
oversee that.
kind of solely function to oversee the agencies.
Yes, yeah, those
But-
kind of help that side of it, correct. Some of the other things that have been discussed have been a little bit misrepresented in terms of like elimination, like you said. It's restructuring is a much better way of looking at that, but unfortunately.
And so this is not really a hostile takeover of an agency on the aging.
You looking at me?
No.
Oh, okay, sorry.
Just a lot of fire.
It felt that way to all of us in the beginning, but communication
Certainly.
has been open now and.
Certainly is not the intent.
Yeah, I believe that, yes, I understand. But we were answering to our people too.
Oh, yeah.
We spend a lot of time at the senior centers having lunch and talking to people and going to their homes and doing assessments, and that was the first question until, we didn't have any answers, and so I think that certainly added to the dismay in the
Distrust.
community. But now that the lines of communication are open up and Dan and I and Aaron and Michelle are communicating and talking about all this, we're seeing that it's not as extreme.
It's hostile.
Yes,
Went out in the
not as
public as
hostile.
dying, people losing their jobs.
Not hostile at all.
Well, one of the things we kept hearing about from different angles, that programs are going to be affected, but what you just discussed in creating this position is more of a streamline. Is there a lot, do you actually document what's, I'm sure there's redundancies when you have so many people doing, do you, I mean, if the programs remain the same and your duplication of work sometimes, which
Right.
happens a lot in management, I mean, do we have that documented, that we know that these programs still exist, and this is the reason why you changed this
That's
position?
actually what we, to the lines of communication, if you will, and the collaboration about designing this for the public hearing and for the board's application as well. We're working on that exact thing. We're making sure that those functions are assigned to the right places at the right time, that at the expense that's right sized for the county. Instead of having numerous high-level people assigned one administrative task and assigned a supervisory title, we're looking at basically right-sizing those positions back to where they belong, which is in the community providing the services, and leaving management to management. So things like reporting and compliance and those things that are really management functions, those are best left to management level positions, but we don't need 7 of those to do that. You need somebody that's responsible for them and somebody that's responsible for that person, for that redundancy we have in government. But in that situation, these folks here are really, I'm not putting words in your mouth, they're very committed to assuring that the plan that we present to the board is on both sides of the fence, completely vetted and completely agreeable. So we have no intent of, if there's a gap in service, there's something that really needs to be shored up with some specific function, some specific position, we'll make that recommendation as part of our resolution when we present this as a package. It will restructure the department and it will right-size it. I think that is, they're saying that there's not going to be the levels of management in aging that exist now. We're very convinced that past installations have worked better in that, and we're moving back towards that with some recognition.
So the senior levels within your department, the senior outreach workers had additional responsibilities.
Right.
And so is that, there's going to be a different person to do those now? And so your outreach workers, the talk yesterday, that was, I can say the word demotion.
Yeah.
As far as pay rates, I think there's one person as far as the outreach workers, that there's gonna be a demotion or decrease in their pay level.
You'd have to go through the whole civil service layoff process if it gets to that point. It is very specific in defining civil service law how that would work. So I think it's a little broad to say, one person will get a paid demotion. There's a whole exercise that it has to.
But I think he's not, like, saying that there's a potential that there might be a couple promotions.
Yeah, a couple
There
of
could-
promotions.
there could be
Right, there's
promotions.
potential that there is promotions for those seniors, or a demotion.
I think there's likely to be some movement.
Yeah.
Leave it at that for the moment.
Right.
Why it's a reorganization.
Correct.
Right.
So to cover what I think Dr. Wanger was getting at and tie it together with what Dan was just saying is, and we kind of agreed yesterday at HHS that the two management positions really should come from within. Just, there's people capable of doing them. And I think that causes the transition to be smoother and for both the team and the community. So there's still seeing the same faces out there. So if that were to happen, you got 4 seniors, theoretically 2 of them now take those management positions and we still keep a senior. That's 1 senior left without a seat at the senior, the management table. So that person, following the civil service laws, would be, we imagine, offered to stay as an outreach worker, which has to go down to the outreach worker pay. But your other part of that is these programs at each senior. I was the high cap coordinator. So each of the seniors had a program that they did the compliance and the reporting and all that to the state on a monthly, quarterly, and annual basis, and did all these trainings, continuing education. Those would now go to the management people, so that the outreach workers who, the boots on the ground, Mr. Corey was talking about, actually can cover more area. So
That's how you're seeing it?
yeah.
I mean, I
It
think
allows us to eliminate the one outreach worker position that's gonna be that would be eliminated.
if I could rewrite the public narrative, I would, because now we're chasing a rhetoric, but I'm glad that
Yes,
that's exactly the
please.
way that we envisioned it, it just wasn't, that's not how it's communicated, but, yeah, the whole goal is to assure that services, at the very least, stay at the services level that they are, and more likely become expanded based on community need without tying up people in management jobs on a monthly and weekly, whatever it is. I've never found it efficacious to have management people also carrying caseloads. Either it's, because you can't serve both at the same time. You can't manage your own stuff. You need people in authority to make sure that it's done with austerity, and that's just kind of part of this process, so.
So would the Director of Aging Services salary come out of the agency budget? as opposed to-
Yes, they would, just as it is now, they have their own budget, they have their own salaries that are set. The job that you're voting on creating, the director obviously needs its own salary set because it's a new position. We're not refilling the one that was vacated by the previous director, so it needs its own salary set.
Do we have a
Did
recommendation? on that?
HHS make any recommendation on that?
Not that we've understood.
No.
And that's probably appropriate because it's been an ongoing conversation continuously, between commission and auditor and I. Based on where the current, where the other umbrella structure would look at different positions and their authority and then their level of responsibility and their level of oversight, and based on a conversation we had 2 hours ago, 2.5 hours ago, probably, unless you have a different thought, at this point, that director is probably appropriate at $72,000.
And that falls in line with the director positions on our side of the fence as well.
Correct.
And that's another thing that we really think is important in the county, that similar levels through the county, and I'll use it again, ecosystem, should be relatively, there shouldn't be such aberrations, and like, this director is this, but the director is over here. I mean, certain levels exist, seniors, directors, these are titles that are kind of ubiquitous across many programs. Commissioners are a little bit of an anomaly because they're in civil services law, but I think that helps right-size salaries, responsibilities, titles, all those things. So I agree with Mr. Caldwell. I think that's a target because it fits with the other side of it.
So we need to create one salary line for that.
I believe so.
And so just creating this position would then we have for the finance.
Correct.
So you'd have to do a position statement?
Correct. We have, the commissioner and I have done a lot of work on this already. We're about ready to cross the finish line and what the job description was like. There's just some details that we're fine tuning, but other than that, we're almost done. And that's what I appreciate about this effort is he's recognized how important that part of the process is before we've come to this table.
What did you say this
I occasionally get some-
recommendation is?
72,000.
And of course, the director position will be vacated. The previous one.
Well, I'm glad there's been a lot of more collaboration between, you know, of course, there has to be in order to have this peaceful transition and continuity of the services that we folks so greatly send out to our seniors, that we don't want to see any decrease in that, and that's certainly not any, that wasn't our goal, the goal or the thought. It's just,
No, not at all. I never
No,
was ever
of course
putting
not.
services even in consideration. I admittedly, because of events that were beyond our control about the director and the situation there, that was almost impossible to have a level of collaboration and kind of a unified going forwards project, but I think we're there now. And certainly I think that however we ended up here, it's a good place to be, to make this a successful thing. And obviously support the seniors in the community that really depend on these services.
Absolutely.
So,
any further questions?
So under DSS, your director of services is 75,000.
and that's mostly because the person that has been there for a good
Bunch of years.
Yeah.
Long time. And ideally, that would become vacant, right? If this deputy commissioner position is approved. And then the commissioner will come back to refill that, and we'll recognize the difference at that time.
And
The aforementioned, making the flush budget.
Correct.
so I make a recommendation that we create the director of aging services at 72,000
For the finance.
for the finance.
Yep. I would not put an effective date on it. I did put an effective date on the agenda, but I'd probably recommend you don't yet because it may not be that soon. Maybe no sooner than June 22nd.
No sooner than June 22nd. Okay with that?
Yep.
So that's your motion, you're moving this?
Yes.
Okay.
I'll second.
Chairman seconds. Any further comments or questions, Mr. Corey? Sorry.
See you read
Make your red list. All in favor?
Embarrassing.
Aye.
Aye.
Opposed? Okay.
I can roll up there.
So do we need to make a recommendation to the full board to eliminate the director position?
That'll be included in the new resolution that will replace the resolution that was tabled last time around. That will be in the resolution.
So do we need to,
At a later time.
The state, we have to wait till the state approves our new plan before we make any changes to the current setup.
yeah, this is all
Right.
going to be put before the state.
Okay.
Kind of plan first.
And you're working on the flow chart so we could all see how it all.
We will have a very professionally done presentation to the board after the public hearing that will delineate all of the services and how they're being accommodated to this district.
And there's no diminishment or decrease in services by any shape or imagination.
No, and like I mentioned to my colleagues here, it should come from them.
Yes.
They are in the best position to say that the services are going to continue, quite frankly, what we got.
Very true.
Yes.
Thank you for your
To help
work.
understand, what are your positions?
I'm a senior outreach worker and high cap coordinator.
Okay.
I help people with their Medicare, Medicaid. And that's the high cap
Yeah.
program, but I do everything else too.
What's your name?
Aaron.
Aaron Weeks.
Aaron Weeks, that's
You
right.
have to give them the last
I
name.
know, big Aaron.
Yeah, little
And then
Aaron.
here's Aaron.
And I should mention that Aaron was a caseworker for us prior to that position, so he's familiar with that.
And then you have
You are.
Aaron for
I'm
nutritional
the
services.
nutrition services coordinator, and my name is Erin Conford. So I oversee the nutrition program as a whole, the senior centers, the home delivered meals.
Which we haven't addressed here, and I know there's members of the public, that's not being touched at all.
Yep,
right?
all
And our-
those will be there.
Except there was one position related to that at the county jail that was
Originally,
possibly gonna be eliminated.
it's not gonna be now.
Yeah, we've got
Okay.
that, yeah. That's part of the request.
Anywhere.
I'm the
Sorry.
deputy director of fiscal, not like acting director, Michelle Wilson.
Well, this is productive.
Yeah.
I tend to be long-winded, I apologize.
No, that's good.
Okay, well, we can move on, I think.
All right, good.
Thank you.
Thank you very much for coming and
Yeah.
being ready to answer questions.
We sure do.
All right, Matt.
Okay, everybody got a little gas left in the tank?
Sure.
Let's see what we can do.
No.
I'm with ya. Drag us along, here we go. All right, these are positions, CSEA or other union positions, mostly CSEA, approved at standing committees and have gone straight to the board chair for approval without coming here. Public Works Committee, there's an HMEO, there are subsequent backfills, starting rate $25.80 an hour. Yep, that was number one. Okay, so there were two, basically. And the path is HMEO, MEO, labor Monday through Friday, labor Tuesday through Saturday. So in both of these cases, it could be a HMEO gets refilled, then the MEO, then the labor, then the Tuesday through Saturday labor. So a total of 8. With 2 approvals, it could be a total of 8. This is the org chart for DPW, so if you have vision better than mine, you might be able to see kind of what that looks like. Yeah, there are a lot of these budget lines are various because they're paid based on what project they're working on, and how those reimbursements happen.